from the station that's on your side. This is Channel 7 News Daybreak.
And so this is a hard conversation to have about good health or being healthy that doesn't include diet. Unfortunately, though, many people having enough food to even eat, much less worrying about it, is being healthy or unhealthy. In studio with us this morning to discuss food insecurity, Dr. John Allen Cockerell of Sherwood Family Medical Center. And Dr. Cockerell, thanks for joining us. This is a tough topic to tackle, especially here in Arkansas. So let's talk about food insecurity, just the definition of it, because I know it goes beyond just I'm hungry.
Right, yeah. Absolutely. So food insecurity, the USDA, I think, probably has one of the better definitions for it. It's the lack of consistency of access to healthy foods. So the lack of consistency being a big word, to healthy foods. It underpins a lot of individual health, but also a population, health look as well. So it's been around for a long time. It's not a new concept, but especially with global food shortages, and those things going on now. It's a global issue, yes, but you mentioned Arkansas.
Yeah, let's talk
drill
about
down
that.
to the local level here too. It really affects a lot of us here in this state too. So.
Eye-opening numbers, and when you've looked at them, and I know that this is something we've discussed before, but it changes every year. And,
sure.
and what numbers? What are the latest data showing about food insecurity in Arkansas?
So right now we're looking at 1 in 5 Arkansans being identified as food insecure. And again, that plays directly with health.
20% of the state's population.
Absolutely.
Wow.
And even higher for children in some areas. So this is a sobering statistic too. Over 25% in some areas, up to a third of children in certain areas of the state are defined as food insecure.
Okay, so now when it comes to food insecurity, if you know someone who might fall into one of those categories, what's a way to approach something like this?
That's a great question, and that's what I wanted to hopefully focus on too, because there's the problem, right?
Right.
But this is not just a theory or a statistical model. We do that sometimes and talk about numbers and okay, what do you do with it? This is actually something that can have practical change.
Okay.
And so I am happy to say that Baptist, yes, is a leader in this. So if you are food insecure or you think you may be food insecure, know someone that is, right? There are resources out there. So this is not just theory. We can actually hopefully help identify some change and give some resources here. So to that point, one, talk to your primary care docs, especially those in the Baptist system. We're trained actually to help identify and support people that are food insecure, right? So secondly, BaptistHealthFoundation.org. I wanted to get out there too. BaptistHealthFoundation.org is a resource website that has multiple ways to give, to donate. Maybe if you're on the other side of the fence, not food insecure, you want to help out,
sure.
Right? But if you want to be identified and have some supports and resources given to you, BaptistHealthFoundation.org. Great stuff going on there. Food RX is a huge program that's been sponsored by Baptist that actually links people with resources, with food. Other folks in the area doing this as well, so it's not just Baptist, right?
Sure,
so other hospitals and clinics to food banks and churches. I talk to people a lot about those as resources as well. So again, big issue, underpins a lot of health metrics and how well people do, right? So not just theory, but again, these numbers are pretty big. If you're in that category or think you may be, man, talk to us, right? Talk to your doc or go to BaptistHealthFoundation.org to try to get some more resources because they are available.
Doc, thanks again for coming in this morning and sharing those resources with us. You can also contact Baptist Health for any ongoing health needs by calling the Baptist Health Line. The number's on your screen.